Greetings. I'm going to talk about the common left and right side pain that occurs during pregnancy and how to relieve it. But before I continue, I want to plead with you to please subscribe to my YouTube channel. The link is in my bio, and the name of the my YouTube channel is Nigerian Health TV, as you are seeing on the screen. Please help me subscribe so that we get to 1,000 subscribers. Now back to the topic. You know for sure that a lot of pregnant women complain, especially in the second and third trimester, but worse in the third trimester. That is, especially when it's getting close for them to deliver in their 36, 34, 35, 36, 37 weeks, and even 38 weeks. They normally complain of this, the side of their tummy is paining them. The side of their tummy is paining them. They always want to find out how they can relieve it. So this video is for them, for this category of women. It does not mean it cannot happen in the first trimester, but it's commoner in the third trimester. It's commonest in the third trimester. Now, before I continue, I would like to tell you what causes this left and right side pain during pregnancy. You see, in the second and third trimester, especially in the third trimester, a lot of things happen. The baby gets bigger, and the tummy gets bigger. The woman gains a lot of weight, especially in the second and third trimester. So this puts a strain on the body system too. So now, the number one cause, because of all these things that happen, the weight gain, the increase in size of the baby, the increase in size of the womb, it stresses some systems in the body. And the number one system is stresses as regards to this pain. And what causes side pain in pregnancy is muscle strain. Muscle strain. As the pregnancy increases in size, it stretches the muscle. It stretches the muscle. The size of your muscle, of your tummy, there are muscles there. It stretches them and it strains them. When this happens, the muscles become sore and they start paining you. The muscle become very sore and they start paining you. And because of the strain on the muscle, it's just because of the strain, nothing else. The muscle that is normally relaxed and contracting before, now the muscle is tense, it's spastic. It's tense because your trunk has increased in size, your tummy has increased in size, the muscle is now in full stretch. Because the muscle is stretched, it will strain the muscle and the muscle will become sore. And there can be spasm of the muscle of your side, especially on your right side. Especially on your right side, there can be spasm of the muscle and this causes pain. The stretch on the muscle causes pain. It strains the muscle and this causes pain. You understand? And another reason for this muscle strain is because you're always lying on that side. You're always lying on the sides of your tummy. You know, as the pregnancy progresses, you will be told not to lie on your belly and not to lie on your back, right? You're always lying on the sides. And because you're always lying on the sides, this can strain the muscles. They can strain the muscles and the muscles become sore. That's number two now. Muscle strain from stretch. Increase in size of the baby and stretch of the womb. And muscle becomes sore and become painful. And the number two reason is because of you're always lying on your side and the muscles get tired and become sore and they become painful. Number three is that you know there's what they call round ligament pain. Round ligament pain. You know what round ligament means? Round ligament is form of a rope that holds the womb in place. Now the womb holds the womb in place so that the womb will be stable and be in one place. Now the womb has increased in size and the baby has increased in size. You know what happens? The muscles that the round ligament that used to be very relaxed is permanently stretched. The muscle is permanently the round ligament is permanently stretched. And because the round ligament is permanently stretched, it can cause pain. Imagine somebody just stretch a part of your body in one place. That's what happens. Because the round ligament is permanently stretched, it can cause pain. So round ligament pain is an issue in the third trimester and second trimester of pregnancy. And it's worse on the right. Round ligament pain. The number three reason for this pain is because of cramping of the womb. You know, some women, you will notice as a pregnant woman, especially in the second, especially in the third trimester, your womb will be contracting as if you are experiencing your period. That's why you hear people say, "Doctor, I'm in my third trimester. I'm getting close to delivery. I'm having this tummy, lower abdominal pain. The downside of your tummy will be paining you, and the pain is always very sharp. And the pain looks as if you are ovulating, it's like an ovulation pain, or you are having your period. It's called cramping pain. Cramping pain. You know why? It's because of the stretch of your womb. You know, the womb has increased in size, right? Because the baby has increased in size, the amniotic fluid has increased. The amniotic fluid, you know what it means? The water in which baby swims, it has increased in size. Because it has increased in size, eh, what happens is that the womb stretches. As the womb stretches, it causes pain. You have this cramping pain. It can be very painful. The number five reason for this pain is constipation. Constipation. You know, pregnancy hormone causes generally relaxes the intestine, and because it relaxes the intestine, when you eat, you notice that you used to go to toilet like every day, but as a pregnant woman, you now notice that with time, you no longer go to toilet. Sometimes you go to toilet once in 3 days, twice in a week, once in 2 days, eh? Because of constipation. It's not that you are not eating the right food; you are eating the right food, but because the pregnancy hormone relaxes the intestine. The peristalsis, that is the movement of the intestine, reduces, coupled with the fact that the baby is pressing on the intestine. So you have constipation. So constipation is also part of the reason you are having side pain. And you know the large intestine are on the sides of the tummy, right? Constipation is another reason you are having side pain. Now, those are some of the good reasons. I want to use the word good reasons for side pain in pregnancy: soreness of the muscle, strain on the muscle, stretch of the womb, because you're always lying on your side, round ligament pain, cramping, and digestive issue like constipation. They cause pain on the side during pregnancy. But there are some bad types of side pain that may arise, especially in the first trimester, like cases like ectopic pregnancy. Ectopic pregnancy, you know, we have two fallopian tubes, depending on the side, can cause side pain. So when you have such pain, cramping, and you are having abdominal, you are having bleeding, that is not the normal type of pain you see in pregnancy. That's ectopic pregnancy. You need to go to the hospital. Then appendicitis can also cause you to have pain on the side, especially on the right side. Appendix, when you have appendix, you can also have pain on the side. So ectopic pregnancy, appendicitis, then if you have infection. But aside those theory, I don't want to go into those theory. I just want you to go home with this. Most of the side pain that happens in the third and second trimester are the good type, from muscle soreness, from stretch of the womb, round ligament pain, constipation, and then what do I call it now? Always lying on the side. Five causes of pain in pregnancy. And the good thing is that there is remedy for it. One of the remedy for it is that you reduce your movement. When you have noticed that you're always lying having pain, you're having pain on the right. What you do, you lie on the left. If you're having pain on the left, you lie on the right. Then you can also use what they call warm compress. Warm compress, like you put towel inside warm water and use it to massage this side of the body, or on the sides that is paining you. You will notice that you have some relief. Another way you can have relief is that you sit down in one place and put your leg on top of another. You sit on a chair and put your leg on top of another chair. It will help release the tension that are on your side, and the pain will also reduce. Then there are over-the-counter painkillers that you can use. I don't want to mention them, but they are safe. Eh? Just like medication like paracetamol, they are safe. You can take it for pain. But if you want to go higher, you need to discuss with your doctor. So this side pain is very common, but it can be treated. Sometimes your doctor will tell you to be patient, and immediately you give birth, the pain will go away. It's common. Almost every woman have it. This side pain, muscle sore, from muscle soreness, round ligament pain, always lying on your side, constipation, stretch of the womb, because this kind of pain, and they have remedy. Like warm compress, put warm compress, take paracetamol, sleep on the other side, do a bit of exercise. You can also massage with ice. They can give you relief. Now, I've come to the end of this lecture. Please, I want to beg you again to subscribe to my YouTube channel. The link is in my bio. And the name of my YouTube channel is Nigerian Health TV. Bye bye.